Welcome back to The Vitals, Mount Sinai Health System's newest video podcast. I'm your host, Leslie Schlachter, and I'm excited to continue the conversation on the 5th anniversary of COVID-19. We have two doctors here to discuss it with us because they were here firsthand. This whole measles thing, right? So we learned with like COVID and the flu, since they rapidly mutate, like you get your vaccines regularly. But with the measles, you get it like once and then you're done. So there's people who aren't getting the vaccine saying they don't need it. What's your thought process for those people, right? Because they don't understand that by not getting it, they might be healthy and be okay if they get the measles, but the people around them might not be. It's protecting others, not just yourself.
And then they rush into the emergency room asking for help when they didn't follow
the directions. So what's your thought with that?
I think there's two issues. Number one is, unfortunately, we don't have memory from when these childhood illnesses really killed a lot of kids. Even like Haemophilus influenza B is mostly gone. We used to have to intubate children frequently, even just 15, 20 years ago for these viruses. And kids got really sick. So it was more in the public eye. But I still think that as the damage done to our reputation during COVID, people don't trust us anymore.
Right.
And I think that's where a lot of people aren't. And so people are looking to fringe research and the darkest corners. If you have to go to the darkest corner of the internet to find the answer to something, it's probably not the right thing to do. Right. But I think seeking that out is partially our faults. That's what I think. And I think if we were able to establish better trust 5 years ago, and again, I think it comes down to humility and saying, this is what we know, this is what we don't know. We think this is going to help. We think you should do this. This is probably better. It may not be, but it's worth a try. I think that would have resonated so much better with the American public.
Yeah.
But again, I'm not a politician. I'm not in charge of healthcare policy. I think the measles outbreak is tremendously preventable, and measles is so dangerous for kids. And it's very sad to see. But I don't think the blame is just on what other people might call the crazies. They're responding to something that made them this way. And so I think we have to kind of figure out what that is so we can get their trust back and say, this is why we should be doing.
I mean, I see it in my practice. I'm sure you do too. I mean, the amount of patient advocacy, family advocacy questions, I mean, it's completely different now than it was before the pandemic. People are advocating for themselves almost to their detriment at times, but they're allowed to. And that's where I think where this is coming from.
I do, and I think it's so grounded in politics, which is painful.
We let ourselves get pulled into the political debate, and we were used as a political kind of tool. And I think we lost for it. We lost the most. I mean, the patients, I think, these poor kids who were, sick with measles lost the most, but I think we lost a lot from it.
I think there's a lot to be learned, and I think all we can do is do the best we can. And our principles in healthcare is to use our best judgment, to use our training, to take the best care that we can for our patients and our communities. It's impossible to predict where the paradigm is shifting. There are individuals now who are being ransacked, I won't name any names, who really advanced the NIH and advanced research and spent decades in public service, and yet they are being blamed for helping society in ways that may not have aligned with politically motivated agendas. So I think it's impossible to predict where the ball is going on the football field, but all we can do is do the best we can.
I think on a personal level, like for me as a physician, what I'm trying to do is just remind patients, and it's a one-by-one basis, is I'm on your team. Let me know what your concerns are. Let's see if we could find some partnership in this. And the one-by-one, because I'm sure in your practice too, when you're actually taking care of the one person before you, these bigger feelings of why don't you agree with me, I doubt they're there. It's more like, let's figure out how to get through this together.
Right.
I think we have to show our patients that we are people taking care of people. We're thinking we are here for a reason to help you. And I think that will help establish the trust again.
Do you ever answer, I don't know if patients ask you this, they do for me, what would you do if it was you?
I do.
Answer that?
Or I use the line, I'm going to talk to you like you're my family member. Mm-hmm. You're my brother, you're my sister. Here's what I'm going to tell you. But at the end of the day, it's your call. It's a shared decision making that I'm here to help you with, but I'm just your advisor.
Yeah.
I'm not here to dictate what you're supposed to do because it's your life. I can only tell you based on my medical expertise, X, Y, and Z. Mm-hmm. Choice is yours.
Yeah. Do you do the same?
I usually tell them what I would have done after to make their decision, because I don't want to, sway them too much. If it's a kind of 50-50. They can go either direction. So a lot of times in health, we discuss risk benefits, but rarely is it so obvious which path you should take. And so if it's obvious, I say, this is what I would do if you were my wife and I like my wife. On the labor floor, that's what I would say. But generally speaking, if it's more of a gray area, I'll present it. And if they make a choice that I would have said after they say, this is what I would do, I was like, that's what I would have chosen also. To kind of help them come to terms with their decision.
Yeah, there's like not a lot of guidelines and a lot of what we do in neurosurgery, there's all the gray zone. And so
It's all of medicine.
what I say is I'm going to talk you in and out of all the options. And then you decide which one you like better.
Yeah.
Like,
some people don't like that because they're like, just make a choice for me. But, obviously that's not how we practice
but I tell those,
generally.
I tell those people, like, if I were you, this is what I would do. But here's the reason why, and here's the things you should be prepared for.
Lay it on a platter.
Yeah.
And let them pick from the
carte.
menu.
Exactly.
Yeah. Sometimes it's not a la carte. Either you're all in or, can't a la carte surgery sometimes.
Yeah.
But, okay, so as far as, like, where you guys are at with your practice now, like, do you even think about the pandemic? Does it even cross your mind anymore? Or are we just emotionally moved on?
I think it comes up. Like it's almost like PTSD, where also you start to relive a piece of it. It's like I passed by the operating room where, on March 8th, before I got ill, like that's where I was standing outside with the head of infectious disease, with Dr. Patel. We're looking in and seeing how we're doing a procedure, or we're mock doing a procedure on someone with COVID. And I passed by the room and I think back about, oh, that's what happened. Or we had our pop-up ICU on GP7 East, which is a med-surg unit.
Right.
And it was a crazy situation. We used anesthesia machines, had ventilators, we had ventilators, and if it's never been done before, hopefully it'll never ever be done again. And so,
you know how to do it.
Yeah, now we do.
Yeah.
Responded there to like a rapid response. No, I'm not on the rapid response team anymore, but I was in the area and we heard the overhead page, so I ran over there and I'm like, looks different than it did a few years ago.
Yeah.
So I think it kind of pops up.
There could be like triggering things.
Yeah, triggering things. I think I had small kids at the time, and I think the impact on them, even though if they had their health, it affected them drastically in many other ways in terms of, their education, their social.
How old were they when it hit?
They were 6, and 3.
Wow.
That's tough.
6, 7. Yeah, 6.
No wonder
6,
why
7,
masks were
7.
difficult for him.
It was near impossible. And so, like we chose, the way I saw it is how you described it. Potting off with a group of people and only interacting with that group of people, just like how my boss kind of did it with the team approach, I thought was the smartest move. So our kids can hang out together without masks in this controlled setting. We did it. There was no school, there was nothing else. These were our only social interactions. And so that's how we did it. But obviously still backlash. But like we were able to make a choice for them and help through it. But so I think we're still dealing with some of those ramifications, although it's been a while and they've recovered.
Yeah.
Oh, I've got scars still. I mean, how hard is it to shake a hand?
So hard.
So,
and then you don't want to be
I had a different
when I
experience
go
'cause I
to
had
shake
COVID.
someone's
Yeah.
hand
Uh-huh.
and then they're like, and I'm like, oh, now they think that I don't care. Of course I care, but like it's the right thing to do. It's so awkward now.
It is, because it can't be an a la carte handshake. It's got to be all in and you're going in or not. But now, every time I extend my hand, COVID pops in. I'm thinking, oh, do I go for it? Or do I just kind of...
But not COVID. Like, you're not afraid to get COVID. It's more of
not
like
afraid,
the
but
judgmental, like, are we
it's the
doing this or
habit.
not? Yeah.
It's the habit. I'm in the habit.
I'm going in
of
for the
shaking.
full hug. I have no qualms.
I also
whatsoever.
go in for the full hug.
The immune
Really?
system
I
is
can't do that in
built.
the ER.
The immune system is built that if it doesn't kill you, it makes you stronger. And so, we have to continue building some semblance of immunity. And now that vaccinations are available, the coronavirus isn't novel anymore. It's still dangerous for people, and you can still get it. Flu season this year is awful, and you can still get other things. But I don't want to change, human-human interaction that's we've been doing for thousands of years because of this.
Yeah. No, I agree with you though, but like I mean my patient interactions are different. Like I get to know my patients over many, many months and years and they become family, and still there's some of them that like won't come within 2 feet of me, and I'm like,
That's fine. Respect what
good,
they
we're
want.
good,
Yeah,
we're
yeah,
good,
that's
yeah.
fine.
I'm like, it's okay. It's okay. Yeah.
Yeah.
Do you think the reason why flu was as bad as it was this year is because a lot of people were like, I'm not getting a vaccine?
I have a theory. It's not grounded in science.
We're ready
fully.
for it.
I think that COVID dominated the space of viruses for so long that the other viruses had time to resurge, and there has been a rebalance of power when it comes to infectious disease globally speaking. The habits that we had of staying indoors, different climates, have kind of affected the landscape. And I've read, I forget exactly where, but how the pandemic depressed the other viruses, but now they have created their own resurgence in the last few years. I think that, coupled with vaccine hesitancy, has created almost a little bit of a perfect storm. But I'm not an infectious
pause
disease
for
guy.
one second. Pause for. Do you
think
think that it's possible that those viruses kind of hung down because everyone was wearing masks?
Yes.
Yeah.
I think the response to
reason?
COVID is what
So
tamped
you're
down
saying
those.
masks work,
The fact that we don't
is
let
what you're
people
saying.
hang out to each other.
Masks work.
Huh? Yeah, for other viruses. No, I'm saying
We got him.
No.
I just wanted to get them.
We got him.
you have to use the tool. You have to use a tool for the task at hand.
Right.
And I think that surgical masks are very good for droplet protection, good for flu. Please don't fire me. It works for a specific. I'm still getting a call from Dr. Rich. I know that. Again, you have to use a tool for what it's there for, and I think that this is a great tool for those viruses.
Right.
And I think you did see that even the separating a distance for droplet viruses, especially a lot of our viruses are contact based. Fecal oral. And so a lot of those were just totally gone because now people are actually washing their hands for the first time in human
Is it
history.
just back, or is it back more virulent than it was before?
Well, you haven't been exposed to it in a long time,
Okay,
so your
okay.
immunity is
That's the
weakened, and so therefore your response is
Okay.
stronger to it. This is what I'm saying. Like the immune system is a muscle. If you don't flex it, then it gets weaker and it atrophies.
Therefore,
And
don't
so,
wear masks.
Again, if you're sick, you should probably isolate and not get other people sick, and potentially wear a mask if it's indicated for that specific illness. A lot of them, again, washing hands would probably prevent a lot of it. And in flu season, spreading flu around, I think a surgical mask is quite helpful because it's mostly droplet.
But there's a cultural indifference now that there wasn't
Yes, there's
years
an
ago.
anger.
There's
Yeah.
an anger. There's an animosity. There's I'm tired of this. I got to live my life. I'm not going to always wash my hands, wear my mask, and protect other people.
Yeah.
I've already done my share. That's the impression I've been getting from a lot of folks that I talk to.
In my life experience this year with flu, though, flu's passed around my kids' school, my friends, who many of them are healthcare workers and are all totally vaccinated. I think just sometimes the flu beats the vaccine.
Yeah.
And you could argue that maybe it would have been a significantly worse illness for these people if they didn't get vaccinated.
Right.
This year. But flu, you're picking strains and you're hoping that it's the right
Hoping
strains.
for the best. Yeah.
And it's the same thing with the future COVID vaccines. They're trying to figure out which strains to put in to, and you may win, you may not win potentially with the vaccine.
See, I thought it would just be easier. Like everyone went through COVID, they knew like they had good hand hygiene and wearing masks, and now they understand these diseases better, and they're more likely to wear masks and have better hand hygiene. But that's kind of what I was
that
hoping.
would happen too, and would hope it would happen, and it doesn't seem to be the case.
It's the anger. So, are we, with what you know now, with how we've do we have a handbook now? Are we prepared for future pandemics?
So I think we have enough muscle memory for those of us who went through it. I think that we would be able to step up again in this moment. I do, at least
For
in my
COVID?
department, for
Or
something like COVID. But I think it depends what the illness is. I think a lot.
Let's make it multiple choice. What are the options?
I'm going to say hell no. Can I say that?
Yeah.
Hell no.
Yeah.
Yeah.
And I have a reason, but I'll wait till.
No.
I would be afraid. Yes, there's a lot of people that have muscle memory, and it sounds like you're a very strong, resilient person. I also feel that way. But I would be afraid the people that you would want to count on to be there to help you through it, the people that did it the first time, would be like, I'm out. I can't do this again. It's
The burnout.
Yeah. They're like,
So
I
I
know
think
what this
that's
is going to
very
be like
real.
for another
Yeah.
year. There's no way I'm doing this. I'm going to go trade online.
I think people are still so tired from the original pandemic and angry from either the response or the illness itself, the loss that they had. They're still grieving. That I think it will be much harder to have the same top-down approach. Like, this is what we think you should do. Try and listen to us. I don't think that's going to function at all anymore. But I think the same way we learn if a new study comes out, this is a new study. Like, you now know this about your fellow man in this neighborhood and in this area. And so I think our approach has to shift as well towards it. And then maybe we can potentially respond to it. I think your point that people are burnt out, that I think when in the first few weeks, months of the pandemic, remember people were kind of clapping for the healthcare workers.
Yeah.
I think many of us felt a sense
I want to bring that back.
a sense of pride. No,
Yes.
like we were running into the burning building the whole place was on fire, the whole world's on fire, and we were running and we rolled up our sleeves. And I think that gives you kind of a sense, at least for me, it gave me more of a sense of purpose, of meaning. I'm going to do this. Yes, there's some risk to it, although, again, I got lucky. I had COVID early, so I wasn't as nervous for myself and my family. I knew it wasn't killing kids at that point also in large numbers, which I think, if it was, I think our healthcare system would have shut down, because I think people would have been more scared for their own, little kids at home. I think for physicians in general, I think the sense of your role and job and identity as a doctor or a nurse or a PA, I think that has actually shifted a little bit. It used to be more pride in it, and I'm doing this for the sake of doing it. And I think after the pandemic, people view it more as a job, and it's just a job. And where can I get the best job? And I'm going to try and not necessarily work full-time or part-time, whatever it is. And I think that was a direct result of the burnout.
You know what? That's totally true. I feel that myself. I used to feel, not that I don't feel appreciated by people, and not that I need to be appreciated. It's nice to be appreciated. But pre-pandemic, there was a high level of appreciation, and it, like, they trusted you. Not that we still gave information. And now it's like you're almost dealing with obstruction and judgment, and it's like, I'm trying to help you, like, and I need to deal with, like, proving it to you. It's hard. Yeah, it's difficult to do that every day.
The one thing that I still think about to this day is, like, one of the reasons why I'm still here at Mount Sinai was because of my division, my department, the group of people I work with. I think that, not looking from the outside in, it was nice people were clapping and all, but I think it was just the internal, our group coming together and working together. I'm not saying everyone was happy, but I know a lot of people were miserable during that time period. I think that actually helped me the most not have those burnout. And it's definitely the reason I'm still working here today. The anesthesia job market is crazy. You can pick up and go wherever you want. But I really feel like, at least in my division, I'm part of a team, and that I think is super helpful. So when I think, like, if the pandemic comes back, I don't know, maybe I'm naive, but I still think that my team is still going to rally there with me. Like, we're going to hold those shields up and, try and block the onslaught from coming in. And so that for me is what
I feel that way
why
about my
I
team
respond
too.
where I think we can handle it again. Because, like I said, my chairperson was there, but there were a lot of other people in my division. But also, like, even like Dr. Richard's an anesthesiologist. He speaks anesthesia. He knows what we were going through. He was in the hallways with us.
He was there every day,
every
rounding on
day.
every floor.
Yeah, there are only a handful of people. I used to say only a handful of people who were in the hospital more than I was, and my group of anesthesiology friends and colleagues. And he was one of them.
He was everywhere.
Yeah, everywhere. And that, he's still here. So I'm like, okay, I'm still going to be here.
We can do this.
So that's why I have the trust. So on a global scale, I totally hear you. On an individual, like, localized scale, I feel like, I think we are equipped to handle something that comes through that front door.
And we're in a situation, being in New York City, where we are probably going to be one of the first to get hit by something with our diversity, our 3 major international airports, the geography, the way it's built. So
there's a reason why we surged before everyone else.
Right. Yeah. Oh boy, yep.
So this was exactly what I wanted it to be. So I thank you guys so much for being here. Subscribe to the Mount Sinai Health System on YouTube and The Vitals on Apple Podcasts, Spotify, or wherever you get your podcasts.